This is a little presentation that I put together on the prolotherapy procedure to help address some questions and issues about the prolotherapy procedure itself and what we need to do to get started. So we'll go ahead and get up and running here. And a lot of people come to me and they wonder, why do they have pain? They've been to multiple physicians, chiropractors, had tests done, MRIs, all kinds of things, and no one can identify what many of these patients are experiencing. And sometimes they'll be told that they don't have anything wrong with them, surgery is not an option, those kinds of things. And I think that's because we have forgotten that ligaments can be the real source of a lot of pain. And so this first part here is to discuss how that's true. So the ligaments and the tendons are both made of collagen, and collagen is a very strong, very tough protein that is kind of bound together in kind of like a steel cable kind of thing in these ligaments and tendons. The purpose of these things is to hold bones together so that the ligaments hold bone to bone and kind of give them a form so that when you move, it gives a nice solid track and keeps things nice and tight. Those you see the cable there at the bottom where some of the strands are broken, and when these things get damaged, the collagen fibers can break in a very similar manner as to what the picture shows down there. So uh, the ligaments and tendons are very densely innervated with C fibers, which are nerve fibers that transmit signals to the brain to let us know where we are in space, to let us know how much movement is going on and how much stability or instability we have, so that we can stop movements and have reflexes that kind of protect us. When these ligaments and tendons have these broken strands, they can no longer carry the same load as they could carry before, and so that allows some weakness in them, and this weakness allows some stretching. And the stretching is what irritates these nerve fibers because those nerves don't like to stretch, and that can cause pain. These nerve fibers are also sensitive to pressure, which is why we can reproduce a lot of this on our physical exam. When you have laxity from these ligamentous weaknesses, muscles will often try and compensate for that weakness. Well, muscles can't do what ligaments are supposed to do, and so you can get some muscular pain and some spasms and things like that. Additionally, the joints are supposed to track, in a nice smooth pattern, and when that doesn't happen due to this ligamentous laxity, then we can have degeneration of the joint itself. It can kind of grind away on itself, and you have degeneration of the cartilage, and eventually you'll get an overgrowth of this bone. You'll see here on the left is a nice normal knee with a nice joint spaces because of cartilage and meniscus. On the right here, we have a loss of this joint space. And one of the last-ditch efforts that the body will try to do is to grow some additional bone to stabilize that weakened joint, and that's what we see here with these bone spurs. Good news is that we are designed to heal. There are 3 phases with an injury, or in our case with prolotherapy. The first phase of this, after an injury or after the first or any of the prolotherapy procedures, the first phase is the inflammatory phase, and this lasts about 72 hours. Second phase is the proliferative phase, and this can last up to 6 weeks after an injury or prolotherapy. And the third phase is remodeling phase, and that occurs over 18 months. And that means that we can continue to improve and heal and strengthen our bodies 18 months after an injury or after prolotherapy. So many of these things will heal on their own without us having to do anything, but there are certainly some times that we don't have that full healing, and that is incomplete or inadequate healing. So why would that happen? Well, there's lots of reasons for this, and the first one is repetitive injury. If we injure ourselves and we don't allow ourselves to heal appropriately, we don't avoid those stressful activities, then we can have these repetitive injuries. The second one would be severe trauma. If we have damage to these structures that exceeds our body's ability to heal itself, then that can certainly cause some severe issues. We have nutritional deficiencies. That can certainly slow our healing process. We need certain nutritional factors and proteins and vitamins and minerals that are cofactors and involved in this inflammatory process, and then bring these building supplies to the ligaments and tendons when they're damaged so that we can produce new structures. If we don't get enough of those, we're going to have problems. There are certain genetic problems and diseases that inhibit healing, and Ehlers-Danlos and Marfan syndrome are two of those that come to mind, where there's a defect in the collagen production. If you're a smoker, you really need to quit smoking, and one of the reasons in this case is because smoking causes vasoconstriction, and that decreases the blood supply to these damaged areas and can slow down our healing. So that's just one more reason to stop smoking. If you have had steroid shots or have taken steroid medications, that can certainly disrupt the healing process. Some people, when they have pain like this, will often get ESIs, which is an epidural steroid injection, or just get steroid injections in their shoulders and their knees and the various structures that do decrease the symptoms in the short term, but often cause additional problems long term, and that's because steroids are damaging to these tissues, and they certainly prevent the healing process. Another substance that's been shown to disrupt the healing process are anti-inflammatory medications. These are like naproxen, Motrin, ibuprofen, all of those kinds of medications, either by prescription or over the counter, and these can have been shown to disrupt the healing process. Chronic fatigue, if you're not getting adequate rest, that can inhibit the proper healing. We release growth hormone during sleep, and if our sleep is inadequate, we don't have enough of that hormone, and that's a vital hormone to part of the healing process. And certainly there are some other hormonal problems. If, for men, if you're low in testosterone, that can disrupt the healing process as well. So what can we do about it? Well, that's where prolotherapy comes in. So what is prolotherapy and what does it do? Well, it's an injection of a proliferant solution into these tender and weakened areas that stimulates the immune system to heal itself. It does this through an inflammatory process where the fibroblasts that are part of that inflammatory process in these tissues begin to produce new collagen. This happens very quickly after an injury, and within a couple of days we notice some new collagen formation, and that persists, as we talked about earlier, for about 6 weeks. As this collagen matures, it shrinks and tightens up these loosened areas, and so we can really decrease the laxity in these joints. Once we start strengthening these areas, these weakened ligaments and tendons, the stretching of those ligaments and tendons diminishes. And so if you remember back from that cable with the busted strands, if we decrease that stretching, it decreases the irritation on the nerves. So what we're trying to do is we're trying to reestablish this standard kind of steel cable type structure in the ligaments and tendons. We've also shown that prolotherapy can increase or heal cartilage in things like the knee joints and other places like that. So it can have a dramatic effect throughout the body. And there are other mechanisms at play for improving pain. Some patients with prolotherapy benefit nearly immediately from the procedure, and we know that this has to be due to something other than the production of new collagen. Collagen formation just doesn't happen that quickly. So we know that there are other mechanisms at play. Other options besides having the prolotherapy procedure, you can certainly take anti-inflammatory medications and follow common medicine, which says that the RICE protocol is the most appropriate, which is rest, ice, compress, and elevate. Now this does help with symptoms in the short term, but it has not been shown to help with healing long term. Again, a lot of patients get these steroid shots, and I just think they're really bad for musculoskeletal problems. You can take pain medications, and Oklahoma leads the nation, or at least is in the top for pain medication abuse, and that's because of the number of pain medications that we dole out. Some patients choose to tolerate the pain or just live with it. Some want to seek out a surgical alternative or an option, and some patients, by all means, need surgery. And I don't want to say that this can completely replace surgery, because that's certainly not true. But in a lot of cases, we can either postpone or eliminate the need for surgery altogether. And certainly, some patients need a wheelchair if they don't address their issues. So if we're going to get prolotherapy, what complications are we looking at? What could be the potential problems with having the procedure performed? Well, we can have an aggravation of pain and symptoms. We're trying to stimulate the inflammatory process, and that can certainly irritate things a little bit more. We can put a needle into an area that we don't intend to put it. So we can inject into an artery. Depending on where we're injecting, we can inject into the spinal canal itself. we could hit a nerve, we could hit a lung. All of those things are potential complications inherent to doing many of these injections, regardless of prolotherapy or steroid injections. These are potential complications of any of those. Depending on the area that we need to treat, certainly, if we're injecting an ankle, we don't need to worry about the lung. But depending on the area that you need to treat, we'll talk a little more specifically about the potential problems there. If we were to put a needle into the spinal canal itself, you can get a spinal headache, and this is not uncommon when women get epidurals during labor, or if you have to have a lumbar puncture in the emergency department because of headaches or infections or things like that. Some patients have reported migraine. I have not seen that in my practice, but it certainly is a possibility. And again, if we're injecting around ribs or an area right around the lung, there's always a chance that we could hit that lung inadvertently. Now, this is a potentially life-threatening complication that we watch very closely, and we'll talk about that more specifically. If you have an area that needs to be treated around the lung, then we'll talk a little bit more about that, and certainly let me know if that's a concern for you. The nerves that supply the diaphragm come down kind of the inside of the neck, and we often inject around the neck, and we can get close to those nerves. If we get close enough that we anesthetize that nerve, it doesn't send the signal to the diaphragm to breathe correctly, so we could have some respiratory depression, and certainly we would want to watch that. Again, I have not seen that happen, but I have heard of that happening in the past. You could have an allergic reaction to one of the components of the proliferant solution. For the vast majority of patients, the only solution or the only component of the solutions that I use is lidocaine. The other substances are completely natural to the body, so there shouldn't be allergic reactions to those other components. And then we're doing a lot of injections into some of these areas, and that may require a lot of fluid, and I do use lidocaine as part of that, which is necessary. And if I'm starting to use a significant amount of fluid, then we'll calculate the lidocaine toxicity dose for the patient. But generally, this is not a problem, but as long as we watch out for our doses. And the last thing is infection. I've never seen this with a prolotherapy procedure, but it certainly is a possibility. And anytime we put a needle through skin, that's something that we need to consider. So when you come in for your first appointment to discuss prolotherapy, there's a couple of things that we're going to do. First one is that we're going to obtain a history and determine exactly what your pain is and what caused it and what's influencing it. And then we'll obviously do a physical exam to identify those areas that really need to be treated. I'll have you sign an informed consent that just says that you understand the procedure and the risks and benefits of it. I'll have you sign what's called an advanced beneficiary notice. This procedure is not covered by most insurances, and this is a form that says that you understand that you'll be responsible for payment for the procedure. At the time of the procedure, we'll determine how much your procedure will cost, and that will be on the document that you sign. We'll have you sign or we'll have you view the presentation and this one, and you'll have an opportunity to ask any questions that you may have. Some patients experience a lot of discomfort during the procedure, and some are very anxious about having the procedure performed, so we can give you some medication that you can take home and take before the procedure. And often I'll use Valium or related medication for the anxiety of varying doses, and I'll use a pain medication when patients request it. Sometimes it's Norco, sometimes it's Tylenol 3. There's some different options that we can use, and we'll try and tailor it to your specific needs. If you have a significant amount of muscle problems, then we may want to give you a muscle relaxer, and I'll often use Flexeril with that one. If you take any of these medications, make sure that you bring a driver with you to your appointment, because they'll need to drive. You cannot drive yourself on those medications. So before the procedure, if you are prescribed those medications and feel like you need those, make sure you take them about an hour before the procedure. We want to make sure that you've had enough time for that medication to kick in. Obviously, the driver needs to come with you to the appointment and have them ready because they have to drive you home. We can use a topical anesthetic on top of your skin that will help numb up the skin itself for the discomfort associated with the needle. It's not going to help with the deep discomfort of the needle where we're going into those tender areas down deep, but it can help with the skin. That anesthetic takes about an hour to kick in, so we'll need you to show up about an hour early. You'll come in, we'll rub that stuff on, hang out for an hour, and then we'll do the procedure. And then we'll want you to wear appropriate and comfortable clothes. So if we're injecting your knee, it would be appropriate to wear shorts or something like that, so that we can that will facilitate our procedure. The procedure itself, we're going to bring you into the room, place you in the appropriate position for the area that we're injecting. We'll double check the areas that we think need to be injected, and we're going to mark out anatomy in many cases with a grease pencil. Wipes off easily. And then we're going to prepare your skin with chlorhexidine, which is a topical antiseptic to decrease our risk of infection. That deep down pain that we talked about associated with the injection can often be helped with this thing called a Tenet biomodulator. This thing is a device that's kind of similar to a TENS unit, and it targets a very specific voltage that really kind of hits the nerves specifically. The higher I can turn this thing up, the more it's going to distract from the discomfort of the injection itself. So if you want to have this placed, we can certainly do that. These are tender areas that we're injecting into, and there are often multiple of them. So this can be an uncomfortable procedure, so we'll do everything we can to make you comfortable. After the procedure, we'll re-examine those areas, make sure that we've gotten all of the areas treated that need to be treated. You should be pain-free from the initial pain that brought you in. However, like I said, we're doing multiple injections, and it can be a fair amount of fluid. So a lot of patients describe the sensation as an achy fullness, but the pain should be gone. This is a low back. This is what's been marked out with the grease pencil, so that I know kind of where your anatomy is, and that will help facilitate the procedure. After the procedure, you can be sore. We're trying to stimulate the immune response, and some patients, this varies a lot from patient to patient, but some patients have extreme soreness. Most patients tolerate it very well, but I want you to understand that you can be very sore. This generally improves over several days, and we can certainly use pain medications and muscle relaxers as needed. I just want you to avoid those anti-inflammatory medications. Some patients say that they like to have some ice that they can use after the procedure. I prefer that you use heat, but you can use some ice for up to 48 hours on an intermittent basis, like 15 minutes on, 15 minutes off. But understand that is not part of the therapy. I would prefer that we avoid it. It causes vasoconstriction, and it can decrease the healing a little bit. I want you to stay active and moving. All of those things increase the blood flow, and that's certainly one of the things that we want to do. I want you to go out and exercise, but I want you to avoid those vigorous activities until you're pain-free. I'll give you a handout that you can take home and read, and I'll give you a little better guidance. And then you can also reference my website, and I've got some information there that can help with what to expect and what you can do. If you have any issues or concerns, don't hesitate to call us. You can use the contact form on my website. There's a contact form on there, and you can let me know that way. You can try Facebook, but calling is probably the most appropriate way. We'll have you schedule a follow-up appointment in 3 to 4 weeks where we're going to reevaluate you, and we'll probably perform a repeat procedure and just kind of see how you're doing. A couple of frequently asked questions. First one, is this going to hurt? Well, shots are shots, and there are a bunch of them. Depending on the area, there's not much we can do about the fact that they're injections, but we will do several things to try and make you more uncomfortable, and we'll do what you want, as much or as little as you want to do. We can give you those medications. We'll use that biomodulator, and we can give you the anesthetic, the topical anesthetic. After the procedure, certainly you very well may be sore. That soreness varies dramatically from person to person. Again, some really don't have much soreness at all. Some experience a significant amount of soreness, so it really just depends. The soreness does indicate a good, vigorous response for most people, and so that's, in a way, a good thing, even though it's uncomfortable to go through. That soreness can last for a few days, and the average is about 5 days. You really should be tapering away by then. How long will the procedure take? 20 to 30 minutes, depending on the region. Some more, some less. How often do we do this? Well, we'll generally do it about every 3 to 4 weeks. And how many injections will I need, or how many series of injections will I need? Again, it varies from person to person and from injury to injury. Average patient is between 3 and 6 series of injections. Some I've seen need 1, and some I've seen more than 10. But the average would be between 3 and 6. And how long do the effects of this procedure last? Well, we're trying to heal these areas. Once we get them healed, you should be cured of that discomfort unless you re-injure the area. That pretty much covers most of my spots. So now is your time to ask questions. Be sure and let me know what questions you have, and we'll be happy to address those. I look forward to treating your pain and getting you back to 100%. Thanks.